Hello everyone, if you are a medical doctor and looking to migrate to Australia, I always receive this question that how many pathway and which pathway you can apply basically as a medical doctor to migrate to Australia. So there are 4 pathways we'll discuss in this video one by one, and you can see that in which pathway you are fit, and then you can proceed your application for the registration in Australia. The basic requirement, you must complete your bachelor degree in medicine, for example MBBS or MD. You complete it, and if you are from India, then you must be a registration must be did there. And also if you are from other countries, for example Russia, China, Philippines, those kind of countries, even without registration in the home country, still you can apply for this in this pathway. Number 1 pathway we're going to discuss called competent authority pathway, and number 2 is the specialist pathway, number 3 is the generic pathway, number 4 the short-term training in a medical specialty pathway. The first 3 pathways that you can basically register yourself in Australia as a RMP. But 4th one, short-term training in a medical specialty pathway, you cannot register yourself, but you can come to Australia to do short-term training up to 2 years. But you need to go back to your home country and you can practice in your home country. You cannot practice in Australia. But simultaneously, if you can clear the other pathway, for example, if you can pass this AMC part 1 or 2, till then you can again practice in Australia. So I will discuss one by one. First, we will see the competent authority pathway. So if you are from any of these 5 countries, if you are a registered RMP in that country, then directly you can apply for competent pathway in Australia. Number 1 is the UK, and number 2 is the Canada and US, and then New Zealand and Ireland. These are the 5 countries. If you completed process, then you can directly apply for competent pathway in Australia. So many doctors basically just ask me this question: sir, can I pass this PLAB 1 and directly can I come to Australia? So answer is no. You need to pass PLAB 1 and PLAB 2 and go to UK and complete the PY1 and 2 and get the general registration. Once you got this, now you can apply for this competent pathway. Okay, not before that. So in this last 5 countries, आपने यहाँ पर या तो आपने पढ़ाई की हो वहाँ पर, या आपका रजिस्ट्रेशन हो गया हो एग्जाम पास करने के बाद, then you can apply for this competent pathway. Otherwise, then next step is the specialty pathway. So if you did your master degree, MD or MS, so in a specialist pathway directly you can apply for this specific college. For example, if you are from a internal medicine or emergency medicine or surgeon, then you have to apply for your respected college directly. There is no need to write AMC part 1 or part 2. But the question is that many doctors, they just completed their MD or MS, can they apply? So technically yes, they can apply, but practically उन लोगों को नहीं मिल पाता है. ये उन लोगों को ही मिलता है जिनके पास में बहुत ज़्यादा experience है. For example, if you have at least 8 to 10 years of working experience after your MD or MS, and your CV is very extraordinary, not just the clinical experience, you also have some research experience, or you are guiding the other students. For example, if you are working as a assistant professor, associate professor, or SRF you are doing, और आपने बहुत अच्छा काम किया, आपका CV बहुत ही strong है, in that case you can directly go to the specialist pathway. But if you have work experience like 2 to 3 years after your MD or MA, 3, 4, 5 years, so if you have less than 5 years of work experience, then directly you need to apply for the standard pathway. In that again you need to pass AMC part 1 and 2, then you can get the full registration. Next pathway is the standard pathway. This is the highly recommended pathway. So if you did your MBBS or MS recently, आपको ज़्यादा experience नहीं है, आप जो है ना, तो आपके लिए हाईली रिकमेंडेड है कि आप इस पाथवे पे जाएं और ज़्यादा चांसेस रहते हैं जॉब के. और इस पे एडवांटेज ये भी है कि आई मीन यू नो व्हेन यू आर वर्किंग फ्रॉम बिगिनिंग, तो आपको सिस्टम के बारे में पूरा पता होता है. स्पेशलिस्ट पाथवे में बहुत ज़्यादा डिफिकल्टी होती है. आप स्पेशलिस्ट पाथवे में आते हैं तो क्योंकि आपको कुछ भी सिस्टम के बारे में पता नहीं है ऑस्ट्रेलिया में, देन वेरी डिफिकल्ट टू मिंगल इन दिस सिस्टम. दिस इज टोटली डिफरेंट फ्रॉम आवर होम कंट्रीज लाइक इंडिया. तो इसमें क्या है कि बेसिकली आपको जो फर्स्ट स्टेप है वो डॉक्यूमेंट वेरिफिकेशन करनी होती है. वेरिफिकेशन प्लस AMC पोर्टफोलियो नंबर 1, नंबर 2 आपको AMC पार्ट 1 MCQ एग्जाम पास करना होता है अपने होम कंट्री से, एंड देन आपको AMC 2 और WBA प्रोग्राम यू कैन गो. इफ यू डू नॉट वांट टू राइट AMC पार्ट 2, you can go WBA program assessment, and then you can get the registration, and then you have to go for 1 year basically residency, or we can say you have to work as a RM resident medical officer. Then then you can get the registration. Then after that, you have to apply for specialty. So this is the pathway, and at Academically, we will help you in this to your documentation process to pass this English requirement. Also, will help you to pass this AMC MCQ exam. Today, you can contact us at Academically. So number 4 pathway is the short-term training for the medical specialty. Means that you already completed your MD or MS in your home country. Now you want to do some specialist training in Australia. So you can do up to 2 years in Australia. For example, कि आपने surgeon है अपने home country में, and now you want to do sort of training, then you can apply in Australia. But the condition for this, you can not eligible to get the registration in Australia, and you need to go back to your home country to practice there. तो आप यहाँ पर practice नहीं कर सकते हो, आपको जाना पड़ेगा वापस, या फिर इन 2 सालों में अगर आपने जो है AMC 1 और 2 पास कर लिया है, या आपने स्पेशलिस्ट के पाथवे को आपने अप्लाई किया, वहाँ आपका हो जाता है. In that case, you can get the registration, and then you can pursue your dream in Australia. And in this 4 pathway, I have discussed one by one in my YouTube channel, so you can have a look. Or if you have any questions, please leave a comment below, so I will try to answer your queries. And thank you so much for watching this video. Bye.